Thanks so much for joining us and welcome to this webinar, which is titled An Invisible Crisis, Mental Health Care in the Shadow of Israel's 15-year Closure of Gaza. I'm Tania Hary, I'm the Executive Director of Gisha, and I'm joined today by my colleague, Gisha's Field Coordinator, Mohammad Azaiza, and from the Gaza Community Mental Health Program, Dr. Yasser Jamei and Rawia Hamam. I'll ask each speaker also to introduce him or herself and say a few words about his or her work before they begin speaking. So Gisha means access or approach in Hebrew, and we are a human rights organization operating inside of Israel to promote the right to freedom of movement, particularly for residents of Gaza, using legal and public advocacy. And this webinar is actually a soft launch for our forthcoming report, which is based on a focus group that we conducted with mental health care professionals in the Strip in late 2021, together with GCMHP and a few other institutions. And I would say that at Gisha, we've tended to look at the physical aspects and ramifications of the closure policy. You know, we gather a lot of data on movement of goods and movement of people. We're showing the impact of movement restrictions on the economy, on infrastructure, on family life. But this is really the first time that we are delving, I would say, below the surface, looking at the invisible crisis, so to speak. And in the report, which is actually a visual, interactive experience, and I hope it'll be published very soon, we see the impact not just of closure, but also, of course, of the military offensives, the difficult economic situation in Gaza, particularly through the lens of healthcare providers, mental health care providers, who are themselves, of course, experiencing the same closure, the same lack of security and hardship, and are trying to offer intervention. This year, of course, also marks 15 years of a tightened closure on Gaza, as well as just over a year since the last of several devastating military operations in the same period of time. I want to note that about half the population of Gaza, of course, is under the age of 18, and some 70% are under the age of 30. So when we're talking about the situation, we can't not address the experience of children and young people. Save the Children recently released a report on the impact of the closure on mental health among children, noting that in 2022, some 80% of children are experiencing emotional distress, compared to what was already a high figure in 2018 of 55%. Of the 2.1 million people living in Gaza, more than 800,000 are under the age of 15, and that means they've never experienced life without closure. I want to start us off with a quote from the report, which comes from one of the colleagues of our friends at the Gaza Community Mental Health Program. And he said, "There's a clear link between the Israeli closure and the grave state of mental health in Gaza. The closure is like a drop of ink in a pool of water, spreading everywhere, touching everything. Gaza's social fabric itself has been reshaped under closure. So have families, communities, and interpersonal dynamics." So let's get started. We have three speakers from Gaza who are going to help us navigate this sometimes difficult and important topic. I'll be posing a series of questions to each of our speakers, and then we're going to open up to questions from the audience. So you can post your question in the Q&A feature at any time, and I'll be gathering these for later. So I'd like to start with Dr. Yasser. It would be great if you could tell us about the Gaza Community Mental Health Program. What services does it provide? What role do you see it playing in the community?
Good afternoon, everybody. Thank you very much, Tania, for the introduction. The Gaza Community Mental Health Program is a non-governmental organization that was established in Gaza in the year 1990. It was founded by Dr. Yasser, who was a psychiatrist and a human rights activist. He is known for his role and even establishment, not only development, but establishment of the mental health sector in Gaza Strip. I think the idea became with him and Ruhama Martin thinking what we can do in order to support the families that we are seeing some of the violations of human rights during the first Intifada after some decades of occupation to Gaza Strip. And the idea was that, the available service was only the psychiatric hospital. Of course, there is a need for some other services, for comprehensive mental health services, where we have a team of psychiatrists, but not only physicians and psychiatrists, but also psychologists, the social worker, and the psychiatric nurse, who could together offer comprehensive mental health services to the population in Gaza Strip. Over the years, we became well-known locally and globally for the services that we are providing as a quality service provider in Gaza Strip. We started with only one community center or a clinic. Now we have 3 community centers, one in Gaza City, the second in Deir al-Balah, and the third in Khan. The provision of comprehensive services is not the only thing that we do. Of course, comprehensive, this includes prevention, treatment, and rehabilitation. But also we have a very nice capacity building program where we train people to become more skilled, with issues related to mental health interventions. And then we have some research work, but of course, this triad of therapy, research, and training is also complemented by something very important, which is raising awareness to the community. We all know about the stigma that is there toward mental health services. So we try our best to reduce that stigma. So this is in brief what we are doing. We work mainly with the community. Our target population are mainly victims of human rights violations. We treat men and women alike, children and adults alike.
Thank you for that. I appreciated that you gave a real overview of also over time, kind of how the center has grown, or multiple centers. Can you share with us a bit about the kind of themes that you've seen emerging in terms of the people that you're treating and people that you're seeing, starting with when you started and also up until today, what kinds of themes are emerging in terms of people's needs on the ground?
Well, when we started, the idea was about, I wasn't at GCMHP when we started, obviously, but it was, the first of its kind service to be presented to the Gazan society. So the question was, what can we offer to the population? That was the reason that we started the clinical experience with the help and support of many international colleagues and experts in the field. So they were visiting Gaza, they were providing training to our staff, sometimes looking at their work, helping them one way or the other, providing supervision, for example, and building their capacities. But with time, the skills and the techniques were already enrooted within the services of GCMHP. There are a couple of issues that are very clear when it comes to the work in Gaza Strip. One is that we are working on long, protracted, or chronic, or ongoing conditions, which is very important. We do not only speak about, offensives every now and then, like every 2 years or 5 years, or etc. We don't speak about the offensives, only about the offensives that began in 2008, for example. And now we speak about 4 large-scale operations, in addition to the massive response to the Great March of Return demonstrations, in addition to COVID-19. These are various things that affected the population, traumatic events that people would expect those to cause post-traumatic stress disorder or increase in anxiety or some related issues. But the other very important factor is the socioeconomic conditions in Gaza Strip and in the occupied areas at large. The Harvard scholar Sarah Roy keeps talking about the economic development that happens or that occurs in Gaza Strip, for example. They can give you some figures. If you look at the unemployment rates in Gaza Strip, they have deteriorated severely, for example, since the blockade. Now the unemployment rate is more than or about 49 to 50%. When it comes to people below the age of 30, it's 60%. Like 2 out of 3 people below the age of 30 are unemployed. When it comes to women, it's more than that, 70, even a little bit more than that. When it comes to, for example, poverty rate, 53% of the population are under poverty rate. Okay, 33% are under severe poverty rate. We speak about Gaza Strip, a small geographical area, 360 square kilometers or 140 square miles, where you have about 2.1 million people, which is more than 5,000 people per square kilometers or 13,000 people per square miles. It's already overcrowded, but now overcrowded, people are poor. When we speak about half of them under poverty line, we speak about 1 million people under poverty line, including about 500,000 children. So these chronic conditions, and I can also draw a parallel, that might bring this reality closer to the minds of the international community. We have suffered a lot globally from COVID-19. We all know what is COVID-19, how it impacted the population when we had the lockdown, and the psychological impact of that lockdown, the increased depression, suicidal ideation, etc., etc. Well, at least I could say that during 15 years of blockade, we had something that is not really different from what happened during COVID-19. Until now, we speak about many of the adults and children who haven't really seen any place outside Gaza Strip. So there are some very traditional presentations of the impact, psychological impact. For example, trauma-related issues like PTSD, acute stress disorder, and there are the other issues related to the difficult and poor economic conditions, like, for example, depression. However, we have seen also some other presentations. For example, we feel that after attacks, we have an increase in people who come with us complaining from obsessive compulsive disorder. At a certain point after 2014, we had many cases of panic disorder. After 2021, now we speak a little bit about more people complaining from bodily symptoms, And it seems that this is related to the chronicity of the stress and how people felt. For example, in May 2021, the very severe bombardment that continues for 20-25 minutes, where people felt nowhere to go, and it was very intensive. That everyone heard, the hearts of the cities. That caused a lot of feeling of, among the parents, for example, the feeling of that we are paralyzed, we cannot do anything to help our children. We cannot even tell them that it's fine, it will go away. You can tell them once, but if it goes for 20-25 minutes, then who's going to believe you from those children? So this feeling of we cannot really do anything to just even to protect our children. It's really not an easy feeling to have. That was also highlighted in Save the Children report. I all the time say that the main two findings in that report are one related to the children and the other one related to the parents. When we say that children feel less safe when away from their parents, how many of those children? 90% in 2022. We speak about March to April 2022, which is about 10 months after the May attacks. Still 90% of the children do not feel safe when they are away from their children, while in 2018 it was 60%. So the children problem is with the fear, with the anxiety, with the worry, with the, that something might happen, might take place, might be wrong at any moment. The other important thing, which is I speak about caregivers, Caregivers, they have high level of emotional distress, 90-60% reporting feeling unhappy and constantly anxious. Why is that? Listen to the next sentence. 2/3 or 63% of caregivers feel they are not useful. What does it mean that you are not useful? As a parent, I could be not useful because I live under poverty. I cannot buy clothes for my children when they go to schools. I cannot really offer good stationery. I cannot offer good food. That's half of the parents in Gaza Strip, I do not feel myself useful because when there is an attack, I have no place to hide my children. There is no safe place, And I feel also myself less useful because this goes and continues for years. Any 18-year-old child now, or 17-year-old child, or adolescent, or for example, young person, would have experienced really 3 to 4 attacks. How would they feel about life? We, as parents or as population, we are not in control of anything, So it's up to what happens. So these reflect, in a clinical sense, in the feeling of being, let me say, helpless. And the other very important word, it's being hopeless, this combination is a very serious one, and it's not a good combination for a father or a mother to feel.
Thank you for that excellent and powerful summary. I think it echoes our decision that to mark 15 years with this kind of look from this particular lens, because of this sense of that it's not ending, that it's not going anywhere. So the kind of the hopelessness and the helplessness over a prolonged period is has this very detrimental impact. I'll come back to you after. I want to check in with our other speakers. So Mohammad was part of the impetus at Gisha for taking on this project, and I know that he was inspired by some of the personal stories that he's heard over the course of his work. So I wanted to ask Mohammad, as somebody who is not a mental health care professional, but somebody who's speaking every day to people on the ground, I would love to hear about some of the specific stories that inspired this project. And if you could also just start by introducing yourself.
First of all, hello to all. It's my honor to be with Ms. Rawia and also Dr. Yasser from Gaza Community Mental Health Program. My name is Mohammad Azaiza. I'm field coordinator and researcher for Gisha. I joined Gisha in 2010, and I'm graduated from Beit Lahem University in 2008 as a occupational therapist. And I'm working for Gisha as a field researcher and field coordinator since 2010 until now. Actually, back to Tania's question about the inspiring story. The stories, when we're speaking about inspiring, we're usually speaking about positive things. But in this way, the things which lead us to speak about the psychological aspects and mental health in Gaza was the situations and the difficult stories that we met every day. And I want to share with you and also with the audience 2 or 3 stories that push me to think with the colleagues at Gisha and also with the colleagues at the Gaza Community Mental Health Program to organize this focus group. Lately, after the May 2021 escalations, I go out to do an interview many streets in Gaza to talk to the people and to see about the effects of the military escalation happened. One of the stories that I met that I meet with women who create their own business by creating a restaurant and a kitchen for them, and it's this kitchen and restaurant become the income generations for these women, and they depend on the work in it totally. And suddenly, in one moment, the tower which include this restaurant and kitchen destroyed totally. I met with them like after 3-4 days of ending the escalations at the destruction of their restaurant and kitchen, and at that moment they are willing to rebuild their business again, and they speak about how they dream about their restaurant, what were the efforts that they put inside this restaurant to build it, and it become like their business, their life, and other things. But lately, when I met this women again, after 1 year of the military escalations, it was shocked for me. One of the women told me simply that for that, we are offered the food and the delicious food for the people. Now, our situation that we are looking for someone to help us to find food for our children. Behind these sentences, I think there is a lot of psychological and mental aspects that should be studied. Another story that you also usually, and after the May escalations, I met with a guy who built their unique business, which hydroponics projects for agriculture, which they use waters instead of land for farming. And it was one of the like only projects in the Middle East who use this system in agriculture. And suddenly this project, which is inspiring for the owners and also for the workers, destroyed totally like number of students who became trained in these projects for the university. And they offer like a fresh vegetables, and also they are use a new mechanisms. And suddenly without any reason in May 2021, and the owners and the workers find themselves in the street without work. And in fact, I met them also after 1 year, and it was like disaster for them that they didn't find anyone to re-support them. They are in problems, and you know, the owners told me the fact that he have like 3 choices: to go to the prison, or to escape out of Gaza, or to be workers inside Israel, so he can like try to retain back the money that he lose in this project. Actually, these 2 stories like lead us to thinking about the situation of the people in Gaza after like 15 years of closure and the blockade. We are like at Gisha keeping like talking about the closure and how it's affect Gaza physically, how many trucks entered, how many trucks exported and imported, how many people like cross the crossing. But we don't speak about the people who are not allowed to cross, how this like affect them inside their feeling.
Thanks, Mohammad. Can you say a few words too about the methodology of the focus group? How many people were involved in it, and maybe just a few words about the main findings, and then we'll go on to Rawia.
Yeah. Actually, after the discussion happened inside Gisha, we go to our partner and our also friends at Gaza Community Mental Health Program and discuss with them the idea about like doing focus group with specialists and professionals from Gaza to discuss about the links between closure and mental health in Gaza. And with Gaza Community Mental Health Program, we invite around 10 specialists from different local and international and other also. The focus group was planned and did in Gaza Community Mental Health Program building in Gaza City, and we discussed like 3 main issues. First, about the effects of the closure on the mental health in Gaza, and also the symptoms that can be appear on the people in Gaza because of the closure, and also the challenge that faces the professional and the specialists in Gaza who provide mental health service to the people. Actually, I attend the focus group and I listen for like interesting and new things that I don't hear it about. And for me, the most like finding that there is like an appear link between the closure and the mental health status in Gaza. Because as Dr. Yasser mentioned, we speak about long term of closure and the crisis which will not end it, and no one can say what happened in 2015, which means that the reasons of the mental health problem in Gaza is something ongoing. And we as a people or professionals or specialists, we don't have any control to change the reasons of these problems. Sometimes one of the findings that was interesting for me, that specialists in Gaza try to offer helps and medication and treatments and to deal with the impacts of the problem. They are not have a control on the reasons. So that's something and the challenge face the professionals who work with the clients in Gaza. And also we hear from the professionals and specialists in this focus group about that they are with the clients live under the same circumstances, which is a closure itself. So I will space for the attendance and also the readers to read the report, which will be published soon. And I think that it can be inspiring for more studies and research about the connection between the closure and the mental health aspects in Gaza.
And thank you for that, Mohammad. So Rawia, I'd be glad to move on and ask you a few questions. I'd be glad if you could speak about the unique experiences of women. We know that there is certainly a connection between also economic hardship and the experience of women all around the world. So I'd be glad to also hear how it is expressed in Gaza. And also about men and children and how they're experiencing the situation differently. So thanks so much. And if you could say a few words about yourself before you start, that would be great.
Okay, thanks, Tania, and hello, everybody. I'm so happy to be with you today. And thanks for my colleagues, Dr. Yasser and Mohammad. And I hope that the audience will find interesting today with us. I'm Rawia Hamam, a community mental health professional, a refugee living in the north of Gaza, a mom of 4, 2 daughters and 2 sons, and working at GCMHP since 1999. I worked with different users of mental health services, like children, women and men. Since 2015 till now, I work as a director of training and research department at Gaza Community Mental Health Program. Maybe I'm intentionally mentioned that I am a mom and I'm a mental health worker or professional, because I think it's maybe the most difficult thing here in Gaza to be a mom or a dad and a mental health worker, that you provide support for others at the same time that you live the same harsh situation. If I want first to talk about the women, specifically women in Gaza, women, whether they are housewives or working women, have many responsibilities and heaviness over their shoulders without real participation really from others, especially husbands. They have responsibility of rearing children, working inside and outside the house. They suffer from other social confinement, which is related to patriarchal power also in this community. In addition to the political blockade, women all the time have also been targeted by the violence of the occupation. For example, the Israel attack in May 2021, 38 women were killed and 397, they are injured while they are sleeping safely at their homes. Also, many physically ill women also were denied to have permits to get out of Gaza to get treatment. For example, El Mizan Human Rights Center, which is based in Gaza, reported that at least 71 women, 71 Palestinians, including 25 women and 9 children, have died since 2011 after their travel permits were denied or delayed. This report was published in this year in March. Also, many women carried economical responsibilities and seek for job opportunities to help their fathers or husbands who stopped working. After the second intifada in 2000, many men, they were stopped from working inside the Green Tent. Also, according to the Palestinian statistics, which is in May 2022, this year, the unemployment rate, as Dr. Yasser said, it's very high. And here I want just to clarify some main results from studies implemented within 2 years here in Gaza regarding the mental health of women. In survey conducted in April 2020, which targeted 1,370 women, Results showed that 42.4% of them have faced problems with their spouses at the time of COVID-19. Furthermore, also showed high proportions of violence committed against women, and economic violence was the highest of all representing. This is in one study, but other studies also said that the psychological violence, which is has the highest number. Also, other study conducted by GCMHP, which is titled "The Consequences of Israeli Attack in May 2021 on the Mental Health of People, especially on the adult." The results showed that depression, it was 80, and depression as a symptom of depression was 80.4%, and anxiety 79%, anger is 75%, and somatic symptoms was 54.7%, were the highest mental health symptoms among adults. When we talk about children, maybe Dr. Yasser talk about that the children, and especially for the report of Save the Children, and shows the high number of children that they are suffered. And I want to mention here that UN Secretary General Antonio, he said that it's no surprise that the lives of children in Gaza have been described as a hell on earth. You know, our children, or the children in the world itself, has 4 basic needs: to grow soundly and to develop good mental health status. These basic needs, they are like attachment and safety, this is the first one. The second, self-efficacy and self-respect and joy. If we want to examine how much these basic needs are being satisfied, we will not find any of them exist within the appropriate and acceptable ones. Children in Gaza conceptualize the world as horrible, terrified, and with no control over their lives. And there was a systemic, purposeful, and intentional planning from the occupation, not just to kill the children physically, but also to distort the cognitive and emotional schemas for the children who are really the future of Palestine. Here, I want also to tell you some results of the study conducted also by GCMHP on the consequences of Israeli attack in 2021 on the mental health of Gaza. The results showed that one of the results showed that the most common symptoms among children were also anxiety, which reached 83%, and inattention 78%, and depression 74%, and sleep problems among the children, which reached 71%. Also, if we want to talk about youth now, the impact of the blockade and the chronicity, we can see that it's a chronic chronicity here in Gaza on youth. We can see that the long-term stress and restrictions on movement imposed by Israel, it is particularly prevalent among young people who are having trouble finding work and feel they have no ways of caring for their families. The employment rate, as Dr. Yasser said, that is very high. And also I want to talk about a research which is published in 2021, which is the titled "Risk and the Protection of Suicidal Behavior Among Palestinian University Students in the Gaza Strip." The study drew attention to the relations between psychological and social and political factors and suicidal behavior as a public health issue, because we couldn't separate the mental health of individuals from the context that they live in. One of the findings of this study showed that 38% of youth said that they thought at least once of suicide, and their motives were increasing by psychological pressure and hopelessness. Maybe it's quickly about the blockade impact on women and youth, children.
Thank you for that. I mean, as you've said, you yourself and all of you on this call are experiencing the same closure, the same trauma, but you're also care providers. I imagine that it's not always, the first question that you get asked is what is the impact on yourself? But I am interested in, and I'm sure the audience as well, how do you work in this environment? What is your experience as a care provider, and what kinds of interventions are possible in this kind of situation that you've described?
Yeah, and Tania, as I said previously, that I think I said that the most difficult thing that you may take in Gaza is to be a mom or a dad or a mental health provider. And in these two cases, you sometimes feel powerless. And to guarantee protection for your beloved ones, protection for your sons and daughters, and also to be sure that the care you can prevent or reduce the relapse of your mental health services users. If you treat the people and they become good, and after another attack, they will relapse. So it's very difficult and painful for the caregivers. But from my point of view, I think that mental health providers face 6 main challenges. I want to take about the first one. The first one, that the care providers all the time, they are wondering whether going to treat the chronic psychological stress consequences such as depression, anxiety, PTSD, etc., or treat the original causes such as human rights violation, which lead to all of these psychological stress and mental illnesses. And in spite of the professional efforts at the level of individuals and the institutions to provide the appropriate care and may reach somehow good results, but another attack, as I said, and continuous stressful events make a quick deterioration and relapse in the case of the clients. And since almost all of the time, there is no recovery period between the attack and the attack. And you treat people who they have PTSD and it's okay, but another attack will happen. And so there's no recovery. There is no breathe for the clients and also for the therapist. So all the time, this creates internal conflict inside the caregiver providers, how they work to prevent their clients' relapses from occurring again. They feel like each time they treat their clients from consequences of trauma and they prepare them to face another one, which is really very painful for them. The second challenge that the care provider also face, the high increase in demand for mental health services. At the same time, there is a clear shortage of mental health providers, and also the nature and the severity of the symptoms that the clients have. These things put pressure or increasing pressure on the shoulder of mental health providers. The third challenge, the high expectations of clients themselves and their families toward the quick change and recovery from psychological problems. They want to shorten the treatment duration related. We work on the social stigma against mental health, but it is still present at the same time. The fourth one, the shortage of the medication, the psychotropic medication, and other medical tools or devices. And sometimes there's delay to reach, for example, the clinics and hospitals in Gaza. When the case managers refer the clients, for example, who need other services, such as medical assistant devices, to other institutions just to continue the treatment. But due to the insufficient funds sometimes, that the institutions couldn't provide these services. Or sometimes some clients who suffer, for example, from chronic illness like cancer and need Israeli permission to get out of Gaza to have treatment. And the Israeli authorities all the time deny or delay the process. Sometimes this process takes from 23 until 70 days. Maybe the patients die before they can get out to go to have treatment. The fifth one is the care providers who live in the same stressful situation and exposed to the traumatic events. and exposed many times to listening. The care providers themselves live the same traumatic event, and they all the time listening to the horrible stories, many stories from other clients. This leads to provoke the mental health provider own trauma and stressors, and maybe the mental health provider deeply engaged or over-identified with their clients, or the opposite. Maybe they avoid to work with the client. At the long run, mental health providers may develop compassion fatigue and burnout if there were no interventions provided to support them. The last challenge, or from my point of view, that the complexity of the psychological problems that the mental health providers face while caring for other people in need. This demands continuous promotion for example, for their professional capability through, for example, training, participation in international conferences, workshops, to experience or to exchange experience with other professionals from outside Gaza. But really, this is difficult, or sometimes it's impossible for the mental health providers to go outside to participate in conferences, or for the experts from outside to enter Gaza. Really, it's very difficult, or really impossible again. In addition to that, when we said that we have to take care of the care providers, for example, to let them to go outside to make retreat, for example, to make entertainment, just to recharge their energy. This is also difficult for them. So it's not easy at all for our professionals. Yeah.
Thank you for laying that out. And I mean, so organized, given we have a short amount of time, and you've given us really a wealth of information on this topic. I want to encourage those who have questions to put them into the Q&A function. Maybe we'll take a few questions from the audience. We have one question that you touched on briefly, Rawia, which is a question about stigma within Palestinian society, and whether it prevents people from seeking treatment, and yeah, if people have kind of preconceptions in relation to people with mental health problems. So so that's one question that can be taken. Who would like to take that? Dr. Yasser, would you like to take that question? And I would also want to throw in one question of my own, which is, after Rawia has discussed the difficulties faced by care providers, I mean, you're running the GCMHP, how do you provide support to your own team? And yeah, so that I would throw in with the question of stigma.
Well, you know, stigma is there in different communities and in almost all cultures, you know, but it varies and it depends upon the complaint. You know, sometimes if the client or the patient has serious complaint, then the stigma might be a little bit more than when you have some other less important issues or less difficult conditions. For example, speaking of stress and the trauma and how people are affected during the attacks or after the attacks, it's like everyone's talk. They all chat about that, and it includes also the psychological implications. However, if you speak about a woman or a girl or a child who is having serious illness, you know, like, for example, for adults like schizophrenia, for children like bedwetting, you know, then it's a big taboo to talk about that. The bottom line is that we need to think all the time of means to overcome the stigma, to make people more aware of what happens. You know, people need really to understand right and correctly why children, for example, act like that. When they become disobedient, or they become a little bit more violent, or when they start bedwetting, it doesn't mean that these children are becoming bad children, but it might be just signs of the inner feelings, you know, and the huge feeling of insecurity and safety, and just seeking some let me say, care from the parents that could be sometimes only offered during just changing of clothes, for example, or just offering a hug, or just a nearby place to sleep. So we need to be aware of that. We are aware of that. One of the figures that I always talk about is that when we were established 32 years ago, we almost had 0 people visiting us self-referrally. Everyone was referred by a physician, who managed to say that your problem is not a physical one, go to a psychiatrist. And nowadays, more than 70% of the people who come to Gaza Community Mental Program are either self-referred or family referred. So you need to have in mind that challenge, and you need to think how we can work around it. Another very important tool is the toll-free line. Because all the time when people are hesitant about reaching out, they can call anonymously from a toll-free, from a mobile or landline, free of charge, and then they can talk a little bit about their ideas, their feelings, their complaints. If they are resistant, they can raise their issues, and at the end of the day, they can decide whether to visit the community center or to stay there. So it's something that we need all the time to keep in mind and to act upon. The issue related to the care for caregivers, or providing some kind of what we call it supportive supervision. And in GCMHP, this is something that was we were aware of many years ago. For example, in the 90s, we used to rely on our international colleagues who used to come and offer some kind of support, containment. Training in itself was something that helped us more understand what's happening, reflection, etc., self-reflection, etc., etc. Now, when the second Intifada began and when the restriction of movement became tighter, we all know that the restriction of movement didn't begin in 2007. It's a very historical thing since the beginning of occupation. But with the second Intifada, the restriction of movement increased. Less international staff were capable of visiting GCMHP or Gaza in general. Then we started to identify local mechanisms. So we have we had an internal clinical supervisor who began to work with our staff since 2005, and in 2009, after the first large-scale operation, we thought that it's more need for that. Currently, we apply 2 main mechanisms. One is peer supervision, where we receive some kind of support from our peers, at the same community center or from the same profession. The other one is individual supervision when there is a need for that. And the third one that we use every now and then when there is a chance is the supportive supervision with some of our international colleagues, experts, and staff who can offer one-on-one supervision for the people in need. It's something that we have to work with. It's not easy. It's challenging. You all the time face the same challenges with the clients. You live in the same reality. You are exposed to the same traumatic condition. You see the same socioeconomic devastation of the community. And then you have every day to try to identify hope and to lighten candles of hope in people's lives. It's not really that much easy, but we try to help each other through, to overcome the psychological fatigue that might happen because of facing the same challenges at the end of the day.
Thank you. I'm seeing we have a lot of good questions. I see one question asking quite straightforward, what can people do who care about this situation? And another question about whether people can volunteer to work with GCMHP. So I'm happy for everybody to say what they think can be done about this situation. So maybe Yasser, we'll start with you and then go around.
Well, we are speaking about a very clear and simple issue, which is violations that continue to take place of the human rights. It's against Palestinian people. We are under occupation. We are under blockade. The very basic and simple thing is to try to restore the feeling of safety and security to the people and allow the children to grow in peace, to grow in justice. And this is the root cause of everything that is happening at the moment. We need to address that one way or the other. So the other issue, which is that for example, GCMHP work with different international colleagues, and support groups through which we can offer some kind of support to our own stuff and to the work that we are doing. And the third thing is that, the most difficult feeling going through the current activity is to feel being alienated, or that you are left behind. Now, one of the main terms that are used in, let me say, international community work, or whatever you can call it, is the NOP, leave no one behind. We are the people who are left behind, not for years, but for decades. Now that need to be challenged. We basically ask people to try to challenge the blockade, to maintain good ties with the Palestinian people, and to look into, let me say, the Palestinian story. We need all the time to read and know more what happens to Palestinian people, and try from our place, wherever we are, to try to support the struggle towards justice and dignity.
Thank you. Rawia, would you have anything you would want to add to that?
Yeah, Tania, let me tell you something about that. If here in Gaza, as a mental health care provider, can provide help to others, I will say yes, we can do, even we live in the same horrible situation. I remember after the Israeli attack in 2013, and we began at GCMHP to provide, for example, stress management and self-care for other providers inside Gaza. One of the participants, attendants, stand up and said to us, how come that you live with us in the same horrible situation and you provide stress management for us? You, like a blind man, catch the other hand of the blind man, and two blind men, and the blind man guide the other one. So I said, okay, let's see, and let's talk and make our techniques in stress management and see. But after we finish it was 3 days for stress management, she said, yes, I feel relief. Thank you. And yes, we can help each other, even we live in the same horrible situation. And for your question, how what we can expect from the colleagues and the people around us, I want to see that injustice anywhere in the world can affect justice everywhere. So it's a call for all of us, everyone in the world, to support the human rights everywhere. And I think the state of mental health in Gaza could improve drastically with a single political decision by Israel to lift the unlawful blockade within the framework of UN Security Council resolution. And for all mental health practitioners and social workers and policymakers should advocate really and respecting the dignity and freedom of the whole population of Palestine to flourish with hope and confidence for a better future. And thanks, Tania. Thanks for all of you.
Thank you. Thank you for this. Mohammad, would you like to add?
Yes, during the discussion in the focus group, I believe and I understand that there's like a high demand on the mental health service in Gaza, and also the specialist and professional, even if they are able to offer the service, there's still this need and demand like overloaded. So in this ocean, I want to ask, if possible, the donors and also specialists all over the world to try to come to Gaza by a way or another, and to look at the mental health needs in Gaza. I know that the people cannot change the reasons of the blockade. It can help. Still, we need experts to come to Gaza. We need the donors to look more and more to the psychological and mental health issue.
I see. The call to prayer started in Gaza, so it was hard to hear the last comment. So we'll wrap up in a few minutes, but I did want to ask one of the questions that came in a few times on the Q&A was to talk about the effects of the pandemic. So You talked very eloquently about how many people around the world, of course, suddenly realized what it was like to be locked down. And in Gaza, you had a lockdown on top of a lockdown. So I'm wondering if anyone would like to take that question, maybe the harmful effects, or maybe if there were any unexpected, positive effects of the situation. Rawia, would you like to take it?
I'm sorry. Sorry, Tania, because maybe the sound is not so clear. I don't hear well. I don't know if Dr. Yasser heard the question.
Just about the effects of the pandemic, of COVID, of lockdown in Gaza. That was some of the questions that came in.
No, I think that the COVID-19 make Gaza in under double confinement, double blockade. But I think maybe the positive thing that maybe the whole people in the world, they understand what is blockade means. What is the meaning that the people, 2 million in a very small area under blockade since over, it's not just 15 years. I didn't say that it's just 15, it's more than 15 years old. So maybe there's the people became more aware and more understandable for this, what it does mean and how much it affects. Once my children, we were in a picnic. There's like hens. You are chicken in a cage. When you open the gate or the door of these chickens, the chickens were very happy and they are running everywhere because they feel that they are free. They can move freely. So my children said to me, "Look, Mom, look at the chicken. They are so happy because the cage, the door was open." How we can, as a people, as daughters and sons, young and men and women, live in an open in a very big prison. Really, I think Dr. Yasser wants also to say something about that.
I think we have issued a fact sheet on the impact of COVID-19 on the population on Gaza Strip. I'm trying to finish it, but I couldn't, unfortunately. It should be on our website. I think let's think of the following. The immediate impact of COVID-19, we could summarize on two facts. One is the social distancing. And imagine one of the main protective factors that people have in Gaza Strip is the strong family cohesion, good family ties, the role of not only the nuclear family, but the extended family and supporting each other's, etc., especially when there is a huge, socioeconomic difficulties, This family structure was really affected due to COVID-19, especially with the need to be distanced from the elderly people. We all the time knew that during COVID-19 that children could be really the least effective. However, they can pass the virus to the older people. So this was one aspect of it. The second aspect of it is the lockdown that was imposed due to COVID-19. For example, lockdown on let's say on some of the activities. For example, open markets. For example, wedding parties, ceremonies, etc., It caused a lot of the businesses that are mainly like, people work from hand to mouth, like, taxi drivers, etc. These were also extremely touched. So, which means in one hand, we have lost one of the main protective factors. And in the other hand, we have added more, we have deepened the socioeconomic hardship. So that's why one of the main findings that happened during the main issues that people reported during the COVID-19 is an increase in violence, domestic violence or violence against women. We have heard many children, they have a lot of irritability and a lot of difficulties because their parents became, there is some sort of, they were like the weak circle within the whole circle, the weak aspect. Of course, this goes in line, by the way, with a lot of the international studies that reported an increase in violence within the population and in response to COVID-19. So I think this was one of the main findings. The other finding was the extreme fear of COVID-19, especially in the very beginning of the pandemic entering into Gaza, and the extreme fear not because that the virus is coming, but because the available resources when it comes to health facilities, health resources, the Gaza Strip is already under-resourced when it comes to various mental, not only mental, but also health issues. Stocks of medicines in the market and in the hospitals are also very scarce. And the people used to understand that if you need some serious intervention, medical intervention, then you have to look for it outside Gaza Strip. So that skepticism about the possibility to deal with a patient with serious COVID complaints, that also led to a series of, or that also led to feeling that fear from the spread of COVID-19. So I think these are the main two issues. But I'd like to ask the audience to look into our website, GCMHP.ps. There is something that is called publications, and that publication there is newsletters and fact sheets. They can look into some of the hopefully interesting findings there.
Thank you so much. So I see that there are quite a few questions that we didn't get to, which we'll try to do over email. Rawia, you summarized almost exactly one of the quotes that I wanted to end our discussion with today. It said the state of mental health in Gaza could improve drastically with a single political decision by the Israeli occupation to remove the closure and allow freedom of movement, including for mental health professionals and their patients. Removing the closure would have an immense impact on people's mental health, because then at least we would have hope. And I think that that's exactly, one of the main things that we've touched on today, which is the issue of hope, the ability to plan, the ability to envision a better future for oneself, for one's children, for one's patients. And I want to thank you all for being with us today. Gisha will continue to work with GCMHP and other partners to remove the closure, as you said, to try to protect human rights and to seek justice for this situation. So thank you all so much for joining us today, and please follow both of our organizations and our work going forward. Thank you.
Thank you. Thank you.
Thank you very much.
Thank you very much.